Today we're going to talk about how to prevent stroke. One of the major ways of preventing stroke is exercise. And why would exercise prevent stroke? Obviously, we'll talk about that a little bit more. So when you're talking about something, it helps to go back to some of the basics. For example, what is a stroke? A stroke is where your brain loses its blood supply. There are two different types of strokes. One is called an ischemic stroke. Ischemia is just a fancy medical term, probably coming from Latin. That means you lose your blood supply. Then there's the hemorrhagic stroke. Hemorrhage, most of us have heard of and understand, and that is where you get a bleed. So there are two different ways where you can get strokes. By far the most common is a ischemic stroke, where you get a clot. And guess what? That gets us back to what we talk about all the time on this channel. Now, cardiovascular inflammation, where you get something like, most commonly, prediabetes, although there are other things, root causes as well, like rheumatoid arthritis, other inflammatory diseases, like psoriatic arthritis, for those of you who have it. Most of the others haven't heard of it. Over 80% of this problem is associated with prediabetes. And prediabetes is very much associated with insulin resistance due to aging. Due to increased body fat is a big issue as well. But I'm going down a bunny trail. Let's go back to some statistics about stroke. Stroke kills about 140,000 Americans each year. That's 1 out of every 20 deaths. Someone in the United States has a stroke every 40 seconds. Every 4 minutes, someone's dying from a stroke. Every year, more than about 800,000 people in the US alone have a stroke. 610,000 of these, or 3/4 of them, are first-time strokes or new strokes. The rest of the strokes are repeat. 1 of 4 are people who have had a previous stroke. 87% of strokes are what we called a minute ago, that Latin term, ischemic stroke. Blood flow to the brain is blocked instead of bleeding, causing that loss of blood supply. Stroke costs about $34 billion each year, and this was what, a couple of years ago on the CDC website. This $34 billion includes cost of healthcare services, medicines to treat stroke, missed days of work, with the biggest items being cost of health services, because stroke is by far the #1 cause of permanent disability, the #1 cause of putting people early in a nursing home. Missed days work is another huge component. Both of these are much bigger items than the medicines alone used to treat strokes. Stroke is the leading cause of serious long-term disability, as we said, and it reduces mobility in more than half of stroke survivors, 65 and older. So, you ask me personally, what do I fear? I don't really fear heart attacks so much. As I mentioned before, I've got more risk factors for stroke, and B, like most of my patients, after working in this space for a few months, I have a very different perspective than I did when I started. Originally, it was, I don't want to die. Most of us don't want to die. But after you start working in this space longer, you begin to change that perspective and say, you know what? What I really don't want is to be disabled. And as I said, stroke is the #1 cause of disability. As I mentioned before, there is a gene for strokes. It's called 4q25. Both of my 4q25 genes are high risk for stroke. And high risk for stroke as a mechanism, the intermediate mechanism for that is atrial fibrillation. I think we'll talk about that just a little bit more a little bit later, but let's go into some basics of preventing stroke. You can't stop aging. You can't change your family history, and you can't change your genetics. But there are a ton of risk factors for stroke that you can control. First, you got to know what they are. History of high blood pressure. High blood pressure is a major risk factor for stroke. Smoking, obviously, is a risk factor for all of these things, resulting in cardiovascular inflammation and therefore heart attack and stroke. Waist to hip ratio. The next few are going to start sounding a lot like prediabetes, insulin resistance. Waist to hip ratio, diet, physical inactivity, and obviously diabetes. Alcohol intake increases stroke risk. Psychosocial stress, cardiac problems, and ratio of apolipoprotein B to A1. If you don't understand that number 10, we have covered that in some other videos. We won't go that deep today. The source for this was the Interstroke study. It was in Lancet 2010, and here's the link for those of you who are interested. Those of you that like to hang around a little bit more of a 6th grade reading level, you can go to Harvard Health, and they have some basic things that you'll see a lot of similarity here. Lower your blood pressure. It's the biggest contributor to risk of stroke for both men and women. Is it bigger than atrial fib? No. For somebody like me, for example, I do have high blood pressure problems. I'll treat it and therefore control it. But since I have atrial fib and the atrial fib genes, those are much bigger risk factor for me than stroke, than even my high blood pressure. So why would they say high blood pressure is the biggest contributor to the risk of stroke in men and women? Because there's a lot more people with high blood pressure problems than there are people with atrial fib. Now, we'll go into atrial fib a little bit more in future videos. One of the problems with atrial fib is we're with atrial fib right now today at the place that we were back in the 60s, 70s, and 80s with high blood pressure. We didn't really check it that much. We didn't know how many people had high blood pressure, and we began to notice that when people had heart attacks and strokes, those people with heart attacks and strokes were much more likely to have high blood pressure. We're finding the same thing now. Since we began to realize that high blood pressure was a risk factor for heart attack and stroke, we started monitoring it. We are not in a mode yet where you have standards to start doing monitoring for atrial fib, but I predict that we will get there. Again, another topic for another time. Lose weight. Obesity and its linked complications raise the odds of having a stroke. If you're overweight, losing as little as 10 pounds can have a real impact on your stroke risk. And guess what? It has a real impact on prediabetes and diabetes risk and heart attack risk. Exercise more. That gets back to the core component of the title for the activity today, the discussion today. Exercise contributes to lowering blood pressure and losing weight, but it also stands on its own as an independent stroke reducer. Now, there's one study that showed a reduction in stroke risk of 11% in moderately active people and 19% in those who were very physically active. And again, we're going to put some links here. We'll put some links on the video description page. And when we get to this, in terms of making it a blog article for the website, we will put the link there as well. Now, one of the things that this article raises is the question of how much in comparison moderate exercise to significant exercise, very physical activity. Now, when you look at heart attack prevention, you cover a major portion of your heart attack risk reduction with just the first components of exercise, just gentle walking. But you get deeper and more effective as you get more physical, and specifically adding high intensity interval training and resistance training. Now, one of the questions that this study raises is decrease of stroke risk a little bit different. In other words, the more strenuous your exercise, does that actually help you prevent stroke more so than that strenuous exercise for heart attack? The answer is we don't know for sure. We did cover an article once which dealt with this specific issue. It was an article from Mayo Clinic, and it looked at mitochondrial mass. What it did find is that you greatly increased your mitochondrial mass, much more so with high-intensity interval training, mostly. Resistance training was a moderate second, and aerobic training or mild activity was a somewhat distant third. So does that mean that more aggressive physical activity is better? I think there's no question that that's the case. The case is how much better. And again, one of the things that hinges on is how important is mitochondrial mass in our muscle tissue. I think most of us would say that's probably not a long putt. Mitochondrial mass in our tissue is very important. Maybe going down a bunny hole here, we'll come back up and go to the next study. Whether it's walking, leisure pursuits, or simply having a physically demanding job, active men and women generally have a 25 to 30% lower risk of stroke or mortality than less active people. So get out there, be active. And, every little activity counts. I don't know if you've noticed this, but I'm standing. I use a standing desk. I have a sitting desk as well, and sometimes I write better when I'm sitting. But when I'm talking and doing videos and stuff like that, I'm standing because every little bit of physical activity helps. In fact, we've done a series of videos on sitting. And sitting, many people like to say, sitting is the new smoking. In other words, it's going to become more and more recognized that sitting is a risk factor for disease and disability. The next study, the optimal duration of exercise has long been debated. One report suggests 30 minutes of moderate intensity exercise is more beneficial to stroke survivors than doing a whole hour of lower intensity exercise. So again, as you see, that's another one of those maybe soft science indicators that moderate to intense activity may be a bigger deal for, especially at least regarding stroke, than it is relative to lower intensity activities compared to heart disease. So again, more to be discovered in that area. Back to Harvard Health and some of their basics on this. Again, as you see, we use some of that as a format, but then we go much deeper in terms of the science. Keeping your blood sugar under control. Basic 101, preventing prediabetes. Prediabetes is the major cause of the problems that we're dealing with. Having high blood sugar damages blood vessels, making soft plaque, which in turn can form a clot. If you drink, do it in moderation. 1 drink per day, the risk is lower. But once you get to 2 drinks, the risk goes up very sharply. And that 1 drink per day is really more for men. It may be for women, maybe a little bit less than 1 drink a day. And I would tell you, from an addictions perspective, any addictive substance like alcohol, if you do it every day, you greatly increase your risk of addiction. So think about some of those things. Bottom line is, for those, a lot of people like to say, well, you should have a glass of red wine each day for your heart. The alcohol helps with some of this stuff, some of the other risk factors, HDL. But overall, in balance, I don't have a problem when a patient tells me I don't drink at all. In fact, I tend to think that's healthier. Quit smoking. Smoking accelerates clot formation, thickens the blood, increases plaque buildup, and does a whole lot of other really bad things. Treat atrial fib. Again, 15% of strokes are due to atrial fib. That's what we know so far. What we don't know is that huge number of what we call cryptic strokes, and we'll talk about those in just a minute. Cryptic strokes that actually were caused by atrial fib that had not been diagnosed yet. Blood thinners and stroke prevention, NOACs, the new oral anticoagulants. That is a whole big discussion in and of itself. Most people that need to be on the NOACs, the novel oral anticoagulants like Eliquis, rivaroxaban, some of the other names, we can go over them later. I've covered those in other videos, Xarelto. Most people that need to be on those are not on those. And you say, oh no, those are scary, those are bad like warfarin. Actually, they're not. Once you start looking at the science, you could actually make a case that they may be less risky than aspirin. One thing they are, though, is they are still very expensive. Natural blood thinners, we've got a video on that. Natural blood thinners for atrial fib, stroke prevention. And that includes things like cumin, garlic, cinnamon, nattokinase, ginkgo, and again, our old friend aspirin. Speaking of videos and atrial fib and this thing about ischemic or cryptogenic stroke, let's talk about that for a minute. We've got, again, this is a link to a couple of our videos in that space. 10 to 20% of people that have atrial fib don't know it for sure, and it's probably more than that. One of the key reasons they don't know it is they don't have symptoms. You'll often talk about, and I'm sure I'll raise a few eyebrows when I make this comment. Have you ever had this little flutter in your chest? Quite often that's nothing, but sometimes that's a run of atrial fib. And what we have found is that people that have atrial fib, even though they have it once or twice a month and really don't think about it, don't notice it, they've got significantly, as in 5 to 8 times, increased risk for stroke. Now, why does that happen? It has to do with, it's not entirely known for sure, but it appears to be something that has to do with pooling of the blood in the auricles. This is going to get quickly into another little bunny hole in terms of how to diagnose it, how to prevent it. And let me hold that for a second. As I said before, we are with atrial fib and that space as a risk factor for strokes where we were back in the 60s with hypertension and heart attack and stroke risk. We're beginning to recognize there's a problem there, but we are nowhere near. We've got to find it before we can deal with it. These days, we've had a significant decrease in mortality from stroke. Stroke used to be the number 2 cause of death. It's now not that. Mostly because of the screening that we've done for high blood pressure and the effective treatment that we've given on a population basis for high blood pressure. There's still a significant amount of strokes out there. And after getting a lot of the high blood pressure related strokes out of there, one of the things we've done is we've lowered the water, we've run into other rocks. And one of those other rocks, again, is atrial fibrillation. Now, we mentioned wearables. I diagnosed my own atrial fib. I suspected it because I had that little fluttering thing. I also knew that I had 4Q25. Both of my 4Q25s were the atrial fib risk. I also knew that I'd been an endurance athlete, although not a good one. I still did it. So I knew I had a lot of risk factors. I woke up at one morning about 2 years ago, and it felt like there was a trout flipping around in my chest. That had happened before. I expected it to go away, but it didn't. I had already bought one of these things that you see on the right. It's called iCardia. It's a little electrode that you can use to find out if you have atrial fib. And I plugged it in, used it. Sure enough, I clearly had atrial fib. I've gone on to get that dealt with. I did not, by the way, get an ablation. A cardiologist friend of mine strongly suggested that I do. He was very proud of his results. He said, gosh, almost a third of his people don't ever have to get a new ablation. And he was proud of that. So here's the point. Ablation is considered to be, quote, a cure for atrial fib. I won't get into what it is or how it works or that sort of thing, but the bottom line is, as I've covered in other videos, atrial fib has a very nasty habit of coming back. I didn't have one. I haven't noticed, haven't had any symptoms, haven't had any problems for the past, couple of years. I did a couple of other things. I improved my sleep. I lost about another 8 pounds or so and increased my exercise. So as you see, there's a lot of stuff in terms of lifestyle that are more effective than ablation. Lifestyle more effective than medications or even surgery. Sound familiar? So let's get to one final study, actually a couple of studies on AFib and exercise. Is it safe to exercise when you're having atrial fib? The bottom line is yes. And as you see in this little image, the guy starts out way overweight, begins to lose weight, and by the end of the exercise, he's gotten to a much lower weight. There's a little bit of license there. It doesn't happen that fast, in case you're wondering. But it does help. And what they did was they actually had people exercising even during fibrillation episodes. I, at one point, was in fibrillation about 20% of the time. And during those times, I could feel it. And a lot of people can feel it. You get nervous. You think, maybe I shouldn't be exercising. That's scary. The reality is they've studied that too. And what they found was continue to push right on through. So a lot of information here about stroke prevention, a lot of information that you probably ought to know. Someone's having a stroke, every minute counts. And again, we got some video on early recognition of stroke. That video covers things like there was a man who suddenly stopped talking. That is actually not that unusual of a presentation of stroke. His wife thought he was kidding around with her and the kids. Then after a couple of minutes, she decided no, he wasn't. She called the emergency department. They took him into the hospital, found the clot, were able to get that clot broken up, and he's talking again. That is not an unusual stroke story. In terms of knowing about stroke, you need to not only know how to prevent it. Obviously, that's the most important thing, but know how to recognize it. Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.